The safety of our guests and members is of utmost importance here at PRVC. Please take 5 minutes and look at this video on how to use our Philips HeartStart defibrillator.
The most easily recognized symptoms of sudden cardiac arrest are lack of responsiveness and lack of normal breathing. First, try to wake the person by tapping or gently shaking her shoulder and shouting, "Are you okay?" If the person doesn't respond, call emergency medical services immediately, usually 911, even if she is not in sudden cardiac arrest. Tell the dispatcher that someone has collapsed and is unresponsive and that you have a home defibrillator. Quickly get it. If someone else is present, one of you should make the emergency call while the other gets the defibrillator. Next, check for breathing. Place your ear over the person's nose and mouth, watching to see if the chest rises. Usually a person in sudden cardiac arrest is not breathing at all, but sometimes abnormal ragged breaths are seen for a short time after collapse. If the person is still not responding and you can't see or feel the chest rise, you should use the defibrillator as quickly as possible. If you're unsure whether the person is breathing, you should still use the device. Place the device on the same side of the person that you are on and open the case. First, you will pull up on the green handle to remove the hard cover. Now this will turn on the defibrillator. You can also turn it on by pressing the green on-off button. Then the device will start giving you clear voice instructions, paced to allow you time to respond to each step.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Quickly bare the person's chest by lifting, tearing, or cutting any clothing, using the scissors provided if necessary.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
Now, peel off the film seal on the pads cartridge. Remove the pads. They're already connected to the defibrillator, which senses when you remove the pads and will continue to guide you.
Look carefully at the pictures on the white adhesive pads.
Peel one pad from the liner and place it exactly as shown in the illustration. It doesn't matter which pad is placed first. Press the pad down firmly to ensure good contact with the skin. Repeat with the other pad. The defibrillator senses when the pads are applied. If they do not make good contact, the smart pads alert the device and it will actually advise you to correct the problem. Now the defibrillator immediately begins to analyze the patient's heart rhythm.
No one should touch the patient. Analyzing.
The caution light flashes as a reminder that no one should touch or move the patient, which may interfere with the analysis. If a shock is needed, the orange shock button will start flashing and the voice will tell you,
Shock advised. Stay clear of patient. Press the flashing orange button now.
Make sure no one is touching the patient. Then press the flashing orange shock button. The defibrillator cannot deliver a shock unless you push the button, and it will permit a shock to be delivered only if it detects a treatable heart rhythm.
Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
Notice the blue I button is blinking at this point.
For help with CPR, press the flashing blue button.
Press it and the device will give you basic coaching in performing CPR. It tells you how to give rescue breaths, where to place your hands, how deeply to compress the chest, and provides a rhythm for doing the compressions. The defibrillator can even tell if the infant child smart pads cartridge is installed, and will then provide instructions for performing CPR on a child. If the patient is breathing, CPR is not needed. Simply tilt the head back to keep the airway open. However, leave the pads attached to the patient and the defibrillator on in case additional shocks are required. In all cases, continue to follow the HeartStart home defibrillator's voice instructions until the emergency team arrives.